Here's a number that should sit with you for a minute. In a 2025 study of nearly 2,000 laundromat customers, over half were on Medicaid, 52.9% to be exact. In a peer reviewed study published in the American Journal of Managed Care, it was examined the health and social needs profile of the population that patronizes coin laundromats across the US. And more than half of everyone that was surveyed had an unmet health related social need. This means food insecurity, unstable housing, unreliable transportation, while only 12% reported an unmet clinical medical need. Researchers conducted a cross sectional observation survey of 1,995 laundromat patrons, and then they stratified this data by insurance status. So there's Medicaid, there's private insurance, there's Medicare, folks who are dual eligible, and then the uninsured. And they measured both the unmet clinical healthcare needs and the unmet health related social needs, such as food, housing, transportation security. And the gap between people needing a doctor and people needing food, shelter, or a ride is enormous. I'm flabbergasted by this, to be honest with you. And it wasn't neighborhood. The researchers compared people at the same exact laundromat, and they still found that Medicaid enrollees reported up to 5 times more unmet needs than the privately insured customers that were standing 3 feet away, folding the same type of towels, using the same type of machines, loading in the same type of coins. So, what does this mean? It means without anyone designing it this way, the American laundromat has quietly become a waiting room for the underserved, a place where the same vulnerable neighbors show up every single week like clockwork, whether or not anyone in a white coat with a stethoscope ever walks through the door. So researchers are now beginning to ask what I find to be a genuinely hopeful question, and that is, what if we meet people there? This is a tried and true community organizing principle. Go where the folks are. Imagine it. You'd have health screenings before the wash and the dry. There could be social workers there supplementing, standing next to the vending machines. We already have mobile clinics. Well, this is an opportunity for the mobile clinics to park right outside the laundromats, because if people are already coming back weekly, guaranteed, for free, no publicity, that's not just a laundry cycle. That's an appointment that nobody even had to coordinate, and certainly nobody canceled. If you made it this far in the video, I'm asking you to like, comment, share, and subscribe. What's more, I challenge you to put another type of neighborhood business in the comments that you think could meet the same public health opportunity as a laundromat. In my view, that's an even swap, not a swindle. Peace.